Good morning. My name's Andrew Chidgey. I'm the Chief Executive of AIDS Concern in Hong Kong. It's my great pleasure to welcome you here to this virtual conference from AIDS Concern. This conference today is really focusing on what do we need to do to end the HIV epidemic in Hong Kong by 2030. We've seen some great progress in previous years, a big drop in new infections since 2015, but still far too many. So we've got some speakers today from Hong Kong, from the region and around the world, to help us explore what is it we need to do next to get infections even lower still. I'd like to extend a big thank you to our sponsors for this conference, Gilead and also ViiV. And I'd like to thank all of our speakers for giving their time and expertise to help us look at this very important challenge. So over the course of today, you will hear many different speakers. The sessions are being recorded, so if you can't see all of them or listen to all of them, you can actually come back and listen again later. If you need translation, you can select to listen in either English or in Cantonese. Some of the sessions are in English, some of them in Cantonese. 如果有廣東話，唔該有 options translation. Okay, right. So this morning we're having sessions concentrating on an update about the HIV epidemic in Hong Kong from Dr. Wong Hing. I'll come to him in a moment. Then we have a session looking at some recent particular challenges, including the impact of COVID, chemsex in the region, and some other challenges. Later on, we'll be hearing more about PrEP and also about LGBT plus health. So it promises to be a really interesting and insightful conference. I'm going to just do a small number of housekeeping explanations. I've explained the translation. If you've got questions during the conference, please put them into the Zoom chat so that we can see them and put as many questions as we can to the speakers at the end of their presentations. Okay, so those were the main things I wanted to say. The reason for the title, Powering Through Global Challenges, is to reflect the fact that we're in a very difficult and unusual time because of the COVID pandemic, which has caused major disruption to so many parts of our lives, but also to the HIV work. So AIDS Concern and many other organisations has been impacted by COVID. We've had to make lots of service changes and adjustments. Now a lot of our service is up and running in the same way again, but of course we've had to switch to virtual format for quite a lot of what we do, including this conference. But at the same time as this global challenge of COVID, we also have the continuing global challenge of HIV. And in Hong Kong, although the numbers have dropped, we're still seeing more than 400 new infections each year in Hong Kong. So this is something that we have work to do on. Okay, so that was what I wanted to say by way of introduction. I'm going to now turn to the programme, and it's my great pleasure and honour to introduce Dr. Wong Hing, who is the consultant for the Special Preventive Programme at the Centre for Health Protection in the Department of Health. He is a very senior doctor who's been working on HIV for decades and knows so much about the local epidemic, but has also been pivotal in driving the interventions that mean we are tackling HIV in Hong Kong. I firstly want to say thank you, Dr. Wong, for all the work you and your colleagues have been doing in the public health system to stop the spread of COVID. It's been a very difficult time in the last couple of years, so thank you for all your efforts. And I'd like to ask you now if you would kindly join us to make your presentation. Thank you very much.
Thank you very much, Andrew, for your kind introduction, and thank you. Thanks to AIDS Concern for inviting me and also organizing this conference. So before I would start the ball rolling for today's very rich program by having a brief overview on the current HIV/AIDS situation in Hong Kong. So the talk will be divided into three main parts: the local epidemiology, current HIV/AIDS strategies review, as well as the new HIV/AIDS strategies formulation, which is under progress. So for the local HIV situation, in fact, the reported HIV cases peaked in 2015, and then it comes down over the past consecutive years. And for AIDS, it somewhat peaked at around 2018, and again, it come down in the last few years. For the routes of transmission, we all know that except for the first few years of the epidemic in Hong Kong, which was mainly contributed by bloodborne transmission, mainly infected hemophilia patients, sexual transmission has been the mainstay of the route of transmission in Hong Kong. Initially, it's heterosexual transmission, but then it was overtaken by the MSM transmission in Hong Kong and up till now. For the last decade, you can see from this schematic diagram, heterosexual transmission has been quite stable for the number of reports every year. For the MSM transmission, as just mentioned, it somewhat peaked. It corresponds with the overall cases in the past decade or so. And then the number actually peaked in around 2017, and it has gradually come down for the trend of the infections. For transmission through injecting drug use, the number of reports has remained low. As for the age of the reported cases, you can see the MSM infections had a younger age, 30-something over the last decade or so. For the heterosexual transmissions, they are a bit older for both the male as well as the female. And the CD4 at the time of the HIV reports, around the time of the diagnosis, will indicate if the patient has a late diagnosis. And you can see from this chart that overall there hasn't been improvement in the proportion of reported cases with a CD4 greater than or equal to 200 per microliter. For the MSM cases, it's a bit better, but for the heterosexual transmissions, they had a bigger proportion of advanced or late diagnosis. How about the prevalence of the key populations? We all know that the MSM community, they had the highest HIV prevalence in Hong Kong. The latest 5 years ago from the PRISM survey revealed a prevalence of about 6.5 among the MSM community. And for the injecting drug users, it's about 1%. TG also is high at about 5%, according to the PRISM 2017. And the future number of cases, the estimation is that in 2020, there are around 8,000 people living with HIV in Hong Kong. And the number will increase to around 8,500 in 2025 and around 9,100 in 2030. And 60% of the people living with HIV will be men who have sex with men. Okay, let's turn to the current HIV responses in Hong Kong. So for the current recommended HIV/AIDS strategies for Hong Kong that span from 2017 to 2021, it was defined that there are two primary target populations, the MSM and people living with HIV. And also there are other key populations, people who inject drug transgender, ethnic minorities, female sex workers, and their clients. And 9 targets has been set then. For the prevention target, you can see here, the red point represent that the current level of response that's fall short substantially of the target. And you can see here, basically the distribution of condom does not meet well the target set by 2020. And for combination HIV prevention services, those key populations who have access at this one item is better. More or less, they reach the target set. And for HIV testing, again, the target is set at 80%, but the current level is around 60% across the different target populations. So here, the trend of the MSM HIV testing, you can see according to the Harris latest one in 2020, the effort testing is around 80% for the MSM. And the testing in the last 1 year and know the result is around 60%. For female sex worker, it's very similar at 60% of those who had tested for HIV and know the result within the last 1 year. And the condom use, again, the level revealed from the survey did not reach the target set. And for the MSM, and also for the PWID, you can see in 2020, from the Harris, there is a rise in the percentage who share needle in the past 1 month. So again, here you see a diagram showing the trend of the condom use in last annual sex in last 6 months among MSM with different partner. And for the those with emotional relationship is at 2020 is around 50%, regular partner around 60%, casual partner around 70%. If we add PrEP use or condom use, either or and or of these two protective behavior, then the percentage rose for across the different partners. But again, I think the percentage has a room for further improvement. How about diagnosis and treatment? In fact, it's not bad for Hong Kong. The level achieved, the 390s, and we can see that the except for the second one, the percent who know they are HIV positive are receiving the antiretroviral treatment. The level is around 84%. But this figure might have been biased or affected by the inadequate information, incomplete information as to the outcome of the of some of the patients who might have already left Hong Kong, or we don't know they are on treatment, but they might have already left Hong Kong and out of the service. As for new infections among children, is quite rare. Okay, so it's 0 among locally born children in 2020. Okay, a summary of the end term review of the strategies, the various targets. For the HIV testing rate, it remains suboptimal for all the key populations. For the condom use, it's below target, but it's found that there is increasing use of PrEP among MSM. We'll go to that a bit more in a moment. For the coverage of prevention message and material, generally it reached the set target, but free condom distribution has been affected by COVID-19, similar to many other clinical or patient services. And the needle sharing among PWID, a rebound in the figure was observed in the latest Harris. And there is, of course, emerging service needs and challenges ahead for all of us. There is the increasing use of new digital channels and format towards sex networking. And there is increasing awareness and use of PrEP among MSM. For recreational drug use, chemsex or chemfam among MSM in the MSM community, it remains a major concern for HIV prevention. At-risk communities, and they are more difficult to access prevention and testing services during COVID-19. So there has been increasing awareness and use of PrEP among MSM. From the Harris 2020, 6.3% of MSM reported the use of PrEP in the past 1 year, compared to 1.1% in a similar survey conducted 2018. So the increase has been quite substantial. And as for the breakdown, 2% of them had taken PrEP in the last 1 year, but not in the past month. And 2.5% have been taking PrEP on a daily basis in the past 1 month. And again, around 2% of them has been taking on demand in the past 1 month. So that's the distribution. And for chemsex among MSM, we have been surveying the phenomenon regularly. And you can see there has been different surveys, the PRISM, the Harris, the different time point. And the chemsex use ranges from 7.3% to 16.2%. And if we exclude the popular and the drug for erectile dysfunction, the percentage becomes lower. And also among the chemsex users, about 5 to 10% of them from the different surveys, they had the slamming practice. So lastly, we'll go to the formulation of the new ACA HIV/AIDS strategies. So the Advisory Council on AIDS has been formulating the next strategies, which will span from 2022 to 2027. So the guiding principles that ACA has adopted has been it adopt an evidence-based approach in the formulation, encourage community participation. It advocates to make the services acceptable, accessible, and affordable by the communities and the society, to build a supportive and enabling environment for HIV prevention and also access to HIV care, and to prioritize the funding to the areas in need. So a community stakeholders consultation meeting was held in July 2027, and 7 sections focusing on female sex worker, people living with HIV, and men who have sex with men, adolescent and youth, people who inject drugs, transgender people, as well as ethnic minorities have been held. And the summary report from the consultation meeting was written and also endorsed by the working group in December 2021. In fact, it has been uploaded to the ACA webpage. So from the consultation meeting, there are 8 major recommendations. To intensify the accessibility and availability of HIV combination prevention tools, targeted prevention interventions and educations for priority populations are needed. To devise specific interventions for the subgroups of concern, within the priority populations. Fourth, to scale up HIV testing services and enhance and support new testing modalities. To strengthen the HIV treatment and care cascade, to enhance and promote youth sexuality education, to reduce and eliminate HIV-related stigma and discrimination, and also to mobilize the collaboration between government and the wider society to create changes. So these recommendations, which come out from the committee stakeholders consultation meeting, form the 8 core strategic areas, and also with priority actions in the new strategies. So you would all know that in the first half of 2022 this year, the framework and draft of the new strategies has been made. And also the revised draft has been put forth for stakeholders as well as public consultation. And in fact, the ACA received quite a number of comments and opinions from the consultation. And thank you indeed for the support. And for the next half of this year, the final draft of the new strategies will be deliberated by the ACA for endorsement, and the new strategies will be launched very soon. So surveillance is, of course, very important. So it has to be continued, and with also the M&E of the HIV responses. The strategic information is to be collected and analyzed through the enhanced surveillance system maintained by DH and backed with thematic surveys, sexual risk behavioral monitoring, and also prevalence studies. And there has to be regular review of the data collected, as well as timely dissemination of the information. So actually, we just started the PRISM TG 2022, the preference survey, as well as a behavioral survey for the MSM and also BD. So here is some of the publicity material. There is a designated website for this PRISM TG 2022. And flow, some of the information on the flow. There is actually it's not complicated. You fill the online questionnaire. You approach the collection point of urine for testing the HIV antibody. Get the urine sample, submit the urine sample, and also obtain an coupon as an incentive for participation in this survey. And then, of course, check the test result after some time. Okay, with that, I close my talk, and thank you for your attention.
Dr. Wong, thank you very much for that very important summary of the current HIV situation in Hong Kong, and really useful insight into a lot of the data that we have that's showing us what the situation is. Thank you also for agreeing to take some questions from the audience. So I've got a number of questions that people are asking that I will put to you now that we'd be grateful to hear your thoughts on. The first one is about the data that you shared on the number of new infections. So we've seen quite a substantial drop since that peak in 2015. And looking at the data, the big drop has been in the MSM cases. I wondered, can you share a little bit more about your thoughts about what are the key reasons for this drop? Because I think people are interested to know what are the changing factors that mean we're seeing fewer new infections.
I believe one contributing factor would be the HIV treatment. That treatment as prevention. That we all know that universal treatment set in a few years ago, and the uptake of treatment in Hong Kong among the people living with HIV who are following up at the HIV clinics is actually quite good. And also with the advance in the treatment regimen, as well as the generally good adherence of people living with HIV, their viral load has been suppressed. A majority of them has been fully suppressed at a very good level. So with this controlled viral load among the people living with HIV, of course, is for those who has been diagnosed with the infection and also go for care and on treatment. But overall, I think this is one contributing factor. And of course, the testing, although the coverage, we would want it to be even better. The coverage among, say, for the MSM, the latest level is around 60% in the last 1 year, as well as know the result. But I don't know, we might have the efforts, the concerted efforts of the NGOs. I think they have been able to reach the target, maybe the targeted segments, those who have a high risk, those who may be at a high risk, high chance of getting the infection. They maybe we are reaching a greater proportion of them.
Yeah.
So we have been able to, I believe, the proportion of getting the diagnosis of the people living with HIV population in Hong Kong, I think there has been improvement in the past years. Yeah.
Okay, so some good progress. Thank you for helping us understand that. So one of the things that we're having presentations on later is about PrEP. And the data from AIDS Concerns Testing Users Survey is showing that nearly 20% of people of MSM who are coming to do HIV testing at AIDS Concern have tried PrEP. That doesn't mean 20% are on PrEP, but 20% say they have tried PrEP, which is a big increase compared to, in our data, compared to a year, 2 years ago. And it's certainly much bigger than the data coming from Harris. Now, I'd expect it to be higher than the data coming from Harris, because Harris is a broader survey than the AIDS Concern BCT users survey. But even so, it's showing growing interest from MSM in PrEP. But I think one of the things that we notice is that when we ask people who are high risk for HIV, why are you not on PrEP? They will say, oh, the barriers. They talk about, I don't know how to get it. It's expensive. So all of these problems. I noticed the strategy, new draft strategy, talks about looking at models for PrEP. Do you think we can see some progress in getting PrEP available in the coming years in Hong Kong?
Yeah, thank you, Andrew. I think that's interesting. Your data, latest data, show around 20% have ever used PrEP. I don't know the time frame. Of course, the Harris that I just pointed out is 6%. Is around 6% is within the last 1 year, and some of them, about 2/3 of them, even within the last 1 month. And yeah, for PrEP, I think is an important modality of prevention within the combination package for HIV. And if there is correct use of the PrEP, of course, we know it must be very effective. And yeah, it's while there has been increasing awareness and also usage of PrEP within the MSM community, I think it's also important to have a good, I mean, it's a correct use. You have to monitor. You have to monitor the use because after all, it's a drug that may have side effect for some of the users. You should have regular monitoring for the drug toxicity per se, as well as the HIV outcome, because while it's effective, there could be breakthrough, especially if sometimes if there is a lapse in the adherence. So it's important to note this point for the users and
quite right. Quite right.
Yeah.
I just wondered if so we've had the pilots at the Chinese University of Hong Kong now on PrEP, looking at local use of PrEP, which are now coming to a close, and we've got very clear evidence from them about people being interested, local population being interested in PrEP and able to use it. And also they're willing to make a financial contribution towards the cost. We've got NGOs educating the community about PrEP, what it is, how to use it, the medical checks that need to be taken, as you've just described. And also some NGOs like AIDS Concern providing medical checkup services for people who are using PrEP. So I just wonder if you have an idea about what the implementation steps might be next for us to open up access, because it seems as though we need to now try and move beyond the pilot phase, really. I mean, I wonder what you think.
Yeah, over the past few years, thanks to the Chinese University, they have conducted very good studies in the local setting on using PrEP, gaining experiences, and which is very positive. And for the new HCA strategies, and there is more mentioning about the PrEP. I think we are moving forward. There has been progress certainly in the last few years, and with the community's opinion, the NGOs, I think it's important there would be a collaboration to take this important subject further in the correct, I would say, in the positive direction for HIV prevention in Hong Kong. I am hopeful there would be progress with time as we all move on. Yeah.
Okay. Well, thank you, Dr. Wong, very much for your time. We really, really do appreciate it. We look forward to working with you further on trying to get to 0 new infections by 2030. Thank you very, very much.